What's up, sports rehab experts? Today we're going to be talking about the number one mistake that I see both athletes and clinicians make when trying to rehab back from a proximal hamstring strain, tear, tendonitis, tendinosis, whatever you want to call it. Proximal hamstring issue, the number one mistake that I see people make over and over again. Now, if you're not a medical professional and you're wondering what proximal hamstring is, where that is located, it's located right up at your butt cheek. So it's where the hamstring, the muscle on the back of your thigh, kind of inserts right up at the butt cheek. And if you were to sit down on a hardwood table or a hardwood chair, it's kind of right where you apply that pressure. So that's one thing that actually usually isn't very comfortable for individuals dealing with some type of proximal hamstring strain, tear, tendonitis, tendinosis, is sitting on a hardwood surface because that area is sensitive. And it actually leads right in to the mistake that most people make. So when you sit on a hardwood chair, you're providing compression down into the tendon. You're providing compression down into the sensitive tissue area. And when you stretch a tendon or when you load a tendon through strength training through a full range of motion, at some point in time, you're going to reach a point of compression to the tendon. And that's the mistake that most people make, is they try to stretch this tendon issue out right off the bat, or they try to go to eccentric strengthening through a full range of motion right off the bat. And it causes a lot of unnecessary discomfort, pain in an individual as they progress through the rehabilitation process. And in some instances, it may actually be doing a little bit harm for them too, because you are creating so much pain and discomfort. And the easiest way to kind of think about this concept, I think, is actually looking at the Achilles tendon. So the Achilles tendon, we all know that it attaches right down at the heel and then goes up, to the calf. And if we're just standing straight vertical, the orientation of that tendon is going to be straight upright. Now, as we start walking or as we start stretching the tendon, the shin goes forward here. So now the tendon is at more of this acute angle and it's moving down in this direction. As the tendon moves down, it's putting more compression down at the insertion point. So that's the compressed area, just like sitting on a hardwood chair, how compression does not necessarily feel good to the tendon when it is sensitive. That's what essentially we're recreating in a stretch or in a full range of motion eccentric activity. So we don't necessarily want to compress the tendon, especially when that tendon is already sensitive. Now, at some point in time, you have to be able to get back into this position. But when the tendon is initially injured or very, very painful or sensitive to movement, this might not be your best option right off the bat. So if we take this back to the hamstring, again, we mentioned attaches right up at the butt crease. So things that put the hamstring on tension, it will actually compress the tendon right on the ischial tuberosity, which is that butt bone that you sit on, is any type of hip flexion, so bringing your knee to your chest, or any type of hip hinging pattern, meaning you're bringing your waist or your torso towards your thigh. Those two movements will stretch the hamstring and it will provide compression to the proximal hamstring on the ischial tuberosity. So, as we have mentioned before, why that is a problem for a currently sensitive or newly injured tissue, that also potentially could be a problem for someone who's been dealing with this issue for months and months. Proximal hamstring strains and tendinosis, I deal with patients who've been dealing with them for months on end and they just have not gotten any better. But even with someone who's been dealing with this issue for months and months on end, I deal with people who've dealt with proximal hamstring issues for multiple months, over 6 to 8 months even. And the first thing I'm going to is still not stretching or eccentric training because the tendon has not been loaded in a manner that actually helps the individual avoid provocation of the tendon. So again, the joint position that applies compression to the tendon is the thing that you actually want to avoid as long as you can until you've built up a foundation of strength and capacity to that tendon again, so that it can then withstand that compressed state. So we have to start strengthening these individuals first and foremost from more of a concentric oriented position. And what that means for your proximal hamstring is more of hip extension and more of a posterior tilt to the pelvis in general. So something where you have more of a leg extended bridge, and then progressing the load in that bridge to a point where it becomes more and more comfortable. And then what we can do is then we can start putting them into more relative degrees of hip flexion, and then asking the hamstring to contract concentrically from that position, or potentially work isometrically or do a full isotonic contraction through a range of motion that is comfortable for them. And then we gradually work into more of that RDL hip hinge type pattern where it puts the muscle on a little bit more length, tension, and compression on the bone. So that is the final state. That's the kind of the final strengthening program that you would put somebody on before they return to play or return to sport. But it's not the first thing that you go to. You have to start training the tendon concentrically, isometrically, and isotonically in positions that it tolerates. And that's from a joint position, which creates more concentric orientation. And then over time, you gradually work to contraction isometrically, concentrically, and isotonically through its full entire range of motion, where the hamstring will actually lengthen to its fullest capacity. So, long story short, if you're dealing with a proximal hamstring issue, stop stretching it, and then find a way to start loading the hamstring in a comfortable manner that is more in a concentric or shortened position, and then start gradually working to more of a lengthened position. And you got to gradually expose that tendon to more and more load over time. Now, that process can be somewhat confusing as far as what type of pace to move at when you're going through that rehabilitation program or process. So if that's something that you're dealing with and you would like some help with that, feel free to reach out me at greg@sportsrehabexpert.com, and I'd be more than happy to set up a time where we can go through those concepts for you and walk you through a little bit more of a strategical approach, a game plan that is very, very methodical, laid out, and shows you the path to kind of getting better with a step-by-step system that has milestones and mile markers that you should hit at every phase of the rehabilitation program. That's exactly what I do when I work with my clients. If you're a rehab professional looking to learn more about the Sports Rehab Expert approach, we have the Sports Rehab Expert Fast Track course, as well as the Sports Rehab Expert certification that teaches you how to work through these injuries in a methodical, systematic approach that allows you to achieve better results on a more consistent basis with your clients. So check out those programs at sportsrehabexpert.com, or again, you can email me at greg@sportsrehabexpert.com, and I'd be more than happy to discuss those programs with you on a further basis. So everyone take care. We'll talk with you then.